Well, we presented here at the IMPAKT conference some research on breast cancer in pregnancy. This is an ongoing registration study since 2003, and we have about 1,700 patients registered in this registry, and we have also collected biomaterial from those patients. And this research started 2 years back, and we had about 150 patients with biomaterial, means tissue, from patients who were diagnosed and treated with breast cancer during pregnancy. And from those patients, finally 100 could be evaluated for mutations in the tissue. So we did an NGS panel on those material from a paraffin-embedded tissue and compared the mutational landscape in these patients with data from the TCGA dataset. First of all, the main aim was to look if the biology of breast cancer diagnosed during pregnancy is different from others. We could not really answer this question completely because our patients were much younger than the TCGA dataset. From a first look at the cohorts younger than 45 years in the TCGA dataset and compared that with ours, we found that the PR3 kinase mutations were much lower in our dataset, and the p53 mutations were much higher. This is in contrast to the TCGA data, and this is in contrast what we found. One explanation might be that the biology is more aggressive. This would support that we have more p53 mutations. Another difference could be that the age, which is driving the breast cancer during pregnancy patients with a median age of below 35, and the TCGA data of where the patients were not that young with a median age of above 40 was also an explanation for that. We split then the patients by hormone receptor status and found that they were hormone receptor negative. There were really no difference between in the breast cancer in pregnancy cohort and the TCGA dataset. But when we looked at the hormone receptor positive cohort, again, this was evident that the main difference was in the PR3 kinase mutations and the TP53 mutations, with the results I just described, less PR3 kinase and more TP53 mutations. So now we are looking further into this difference. Is it a real biology difference? Is it a difference based on the different methodology used to sequence the tumors? Is it the difference because we used FFP and the TCGA used fresh frozen? So there are variants. But it could also be that the biology in these patients is a little bit different because the patients are so much younger. But this is work still to be done. The patients with breast cancer during pregnancy are treated as closely as possible to the general guidelines for young breast cancer patients, because we need absolutely to avoid an undertreatment of those patients. So in general, we can operate those patients anytime during the pregnancy, and after the first trimester, which is around the 14th gestational week, we can also start giving them chemotherapy, the standard chemotherapy. What is more problematic is giving an anti-HER2 treatment, because there were cases that patients suffer from a severe oligo and anhydramnion, so the amniotic fluid is gone or is decreasing substantially, and there were also fatal death reported, but it was never clear it was really related to the anti-HER2 treatment given during pregnancy, or if this event would anyway happen. But for the moment, we recommend not to treat those patients unless there is a real urgency and a highly aggressive breast cancer. What we also postpone to after surgery is the endocrine treatment if the patient has a hormone receptor positive tumor, and radiotherapy, which is usually indicated in all patients with breast conserving therapy and in some patients with mastectomy. Well, the main message is if you have a patient treated with breast cancer during pregnancy, try to register them in the GBG database as far as possible. You can contact us. You find the information on the website gbg.de, and I think we need to learn more about those patients. New drugs are coming up, so we need to update our recommendations as the standard recommendations of how to treat our breast cancer patients in general need to be updated.